because I'm joined here in the studio by Dr. Richard Dawood. He is a director of a Fleet Street Clinic here in London and a travel medicine specialist. And so the World Health Organization has confirmed that this new strain of coronavirus can be passed between people.
Yes.
What does that mean in terms of the potential for this virus to spread even further?
Well, just to say, actually the illness, although it's from the same family as common cold viruses, it actually causes a very much more severe infection, a very severe pneumonia. So people, in general, people who are affected really are pretty ill. So this is a form of the virus that was first found in the Middle East back in September. There have been clusters of cases, Qatar, Saudi Arabia, Jordan, perhaps people travelling to other countries. There was a cluster of cases that was actually brought into the UK in February. A small number of cases in Germany, and now these cases in France. So clearly there is the potential for spread from person to person, and whether or not it goes on to spread more effectively. I mean, it clearly isn't a highly infectious disease. Otherwise we would be seeing many more cases.
Sure, but then now you have a new strain of the virus, which could be more contagious.
This is the strain that has been spreading really since September.
Okay.
And I think the difference, I think the SARS outbreak 10 years ago was a very alarming thing. Partly that was because it was actually several months between the first cases appearing and the high alert that the rest of the world was put on. The first cases appeared in November 2002. It wasn't until March 2003 when cases had started to spread outside,
between the November
allowing the virus to become established.
And so have authorities managed to avoid it, taken steps to prevent that happening this time around?
Well, what's happened over the past 10 years is that there is a very good surveillance system that was put in place by the World Health Organization. Countries are much better primed to look out for cases of this type. They're able to track them, as indeed has happened since this.
So then where is it, given that they are able to track them and there is more surveillance in place, where is it likely to have originated from?
Well, coronaviruses do occur in animals. So the original SARS cases were believed to have come either from civets or from raccoon dogs in China.
Just a quick one, geographically?
Well, who knows? The first cases ended up in the Middle East, began in the Middle East. That's not to say that animal contact might have occurred there, but the amazing thing about SARS in 2003 was that in the short period from March until June or July, it was pretty much, the outbreak was arrested. And I think what will happen now is that the authorities, the World Health Organization and public health authorities in all of the countries affected are going to be on the case. And they will make sure that every new case is tracked and
lessons have been learned since
transmission will be interrupted.
Thank you so much, Dr. Richard Dawood.